Hello and welcome back to my mental health and crime channel. My name is Huda London. I'm a licensed cognitive behavior therapist and a licensed mental health counselor. Please like, share, and subscribe if you enjoy the contents in this channel. Today, I'd like to talk a bit about cognitive behavior therapy and why it is scientifically proven that it's one of the best therapies in mental health counseling. I'm not saying that the other therapies are not effective. Definitely there are. All kind of therapies in mental health counseling is really important. It just depends on what people are going through. There's trauma therapy, there's different kind of therapies, couple counseling, mental health, different kind of mental health counseling. I personally have got my education and my experiences in domestic violence, couples counseling, child psychology, and many other different types of counseling, family therapy, SOFNs, many other ones. But the most, the, the branch that I have taken and I have got my profession in, my expertise in, is cognitive behavior therapy. The reason I love cognitive behavior therapy is not only is it proven to be scientifically proven that it's one of the best therapy, CBT. I like cognitive behavior therapy because it's a here and now therapy. It's a short time therapy. It's not like many years or many months like trauma therapy and such therapies. It's not like psychodynamic therapy. It's not like integrative therapy or mental health counseling. It's more like CBT is really effective because we deal with here and now things that is bothering a patient or a client, like we call them. We usually focus on the problem now and what can be changed or what the person wants to work on. The founder of CBT it came in 1970 actually, and it was the founder of CBT was a man called Aaron Beck. He was from Pennsylvania University, and Aaron Beck came with CBT, cognitive behavior therapy, because he found through his researches and with his clients, he found out the best therapy, the benefits with cognitive behavior therapy is to focus on the here and now. Not to make it a long time therapy that goes for months or years, to make it usually CBT is for 8 to 10 weeks max, unless a person unless a person is referred again to by their general practitioner or by the schools or by the colleges or the workplace or something like that. CBT deals with a lot of kind of mental health illnesses and a lot of mental health issues. We deal with trauma too, we deal with SO offenses, we deal with many mental health illness like bipolar, many different personality disorders. We deal with schizophrenia, deal with people who have ADHD, cognitive issues, many domestic violence, drug addiction, many things. It's more like a talking therapy, and in CBT, when Aaron Beck found CBT, he was the founder of CBT, so he believed that if we change our cognitive way of thinking, our thoughts, to positive thoughts, that will lead to positive emotions, feelings, and then it will lead eventually to positive behavior. So like it's a round circle or triangular. that you have the cognitive on top, then you have the emotions. Like if you change your negative thoughts, negative automatic thoughts to positive thoughts, that can lead to positive emotions, and that will lead to positive behavior. An example is like if you have negative thoughts of like nobody likes me, nobody wants me around here, I'm not wanted, I'm not needed. If you kind of assume and think that, okay, people don't want to have me here, people don't like me here, maybe my friends don't want to hang around with me. Like some people just get an assumption, like just say, I've given that example, I believe, many times before. Like, just say you're in university or college and your classmates and your friends always hang around with you, and one day you pass them and you say, like, hi to them or hello to them, and they do not reply. And then maybe you do it the second time and the same thing happens, then you start making yourself believe, like, you may assume that the person is angry with you, upset with you, or doesn't, or dislikes you, or doesn't want to have anything to do with you because maybe you're boring, maybe you're dislikable, maybe you're not worth having as a friend. That is having automatic negative thoughts. Instead of confronting the person, or instead of actually thinking it in the other way, like maybe the person was busy with something, maybe they did not notice me, maybe they're having their own troubles, such things. And maybe at the end, when you go to the person, so like just say if the person comes to counseling, we try to challenge their negative thoughts by asking them, could it be possible this could have happened? Could it be possible that could have happened? And try to find out where those negative thoughts are coming from. Some people have more negative thoughts in general, and they see things from a negative side. So it's really important to, and just say like the person, just with that example that I was explaining, just say the person goes back to college or uni and sees their friend, and then the friend says, hello, how are you? And then you'll be like, yeah, but I said hello to you the other day and you were ignoring me. And then the person may turn around and say, I did not ignore you. I didn't even see you. I was in my own world. I was busy with this teacher. She put down my grades and it was unfair. And I like, my grandmother just died and I was stressing through some things and all. And then you'd be like, oh, was that the thing? I assumed that you didn't want to speak to me. So it's always important not to assume immediately. It's always important not to get yourself up in that negative circle, because once you start having too much negative thoughts, it leads to negative emotions. Like it'll lead you to it may lead you to having depression. You may end up staying at home. You may think that nobody wants to speak to me, nobody likes me, nobody cares about me, I'm unwanted, I'm dislikable, nobody cares about me, maybe I'm not worth living. And like you start having these thoughts that put you in a depression. So that is from your thoughts, negative thoughts, that puts you into giving you negative emotions like depression or anxiety. And that could lead to negative behavior, like lashing out at people or just staying at home, isolating yourself from people and such things. So it's really important to change the negative thoughts. Your cognitive has the best way to, you can control. That's what Aaron Beck believed, and it really is scientifically proven that it's a very positive CBT. CBT is one of the most positive therapies, because once you have your thoughts, once you take your thoughts and improve it in a positive way, then automatically your life quality, your mental health quality gets much better. CBT is usually used for anxiety, severe anxiety, depression, severe depression. It's called clinical depression. It's used for personality disorders, antisocial personality disorder. We use it for It's very effective for people with personality disorders like bipolar, borderline personality, and so on, schizophrenia, many other things, for sex offenses, for offenders. CBT is very effective for couples counseling. CBT is effective with family therapy. CBT is effective for OCD. CBT is effective in basically to change many things, has to do with the cognitive side. So if you can change your negative automatic thoughts and core beliefs, then it really does lead you to a positive outcome. I'll give you all a quick example. I was speaking to my cousin sister yesterday. She's much younger than me, and she's been working for the last 10 years, I believe, 9.5 years, as an underground tube driver, train driver, the undergrounds of London. And like you all know, London and New York and are one of the most busiest with undergrounds. So obviously when you have undergrounds, a lot of crime happens in the undergrounds. A lot of attempted suicide or suicides can happen. So when my cousin called me yesterday, we were speaking for at least an hour and a half about different topics and all. And then she said me, remind me, what mental health was it that you work as? So I said, it's all kind of mental health, like couple counseling, like trauma. I told her many, because the general work of mine is mental health. But I told her that my speciality is more, my expertise lies more on cognitive behavior and all these things that I've explained, like couples counsel and all these personality disorders, ADHD, all these things, drug addictions, domestic violence, all still are treated under CBT. So I was telling her that. So she said me, that's interesting. And so I said, do you know anything about CBT therapy? So she said, of course. She said, and then she started telling me a bit about it. I was quite impressed. I said, how did you find it? I said, did you read about CBT? She said, me no, Huda. She said, you know, I'm a tube driver. And you know how hectic it is in the underground. So I said, yeah. So she said, a year and a half ago, somebody attempted to do suicide while I was driving, but I was lucky to catch the brakes quickly. And we had to close down the tube and the tube station, and the person was helped out and all that. So she said, because of that, my job, the underground, they sent me to CBT for 8 weeks. So I said, that's interesting. So I said, what did you think about it? I asked her for feedback, and she said, honestly, I thought it was the best thing that I've ever done, because it has helped me even after I finished my 8 sessions and I came back to work. She said, not only did I feel more lighter and more like in less panic and such things, she said, I felt that CBT has helped me to my personal life. She got married 3 years ago. She's having a first baby now. So she said, wherever I go, I take CBT with me. So I was really happy to hear that. So I said, you should continue reading CBT. And she said, that's what I do. And she said, that's what I've advised everybody, all my friends and all that. I keep on advising them, like, if you want to deal with your problems in life, even if you don't have problems, to avoid them, read CBT. She said, there's another friend of mine who works in the same branch as me and in the underground, and she said she was going to similar things at her work too. Not the tragic thing that my cousin experienced, but similar things with the stress and burnouts and all from the work. And she said, our job sends us to CBT therapy. They send us to different kind of mental health, but mostly CBT, because they said it was very effective. She said, I didn't believe it at the start, but once I started CBT, I came back to my boss and I thanked him for that. So she said, my friend even has been recently, she's a head manager, and she was sent for CBT. And she came back and she told me that she gave me excellent feedback. She said I advise everyone to do CBT therapy and all that, to go to CBT therapy. So the reason that I'm saying that is not to build up CBT. I really mean it. CBT is one of the best. You can read it for yourself. It is. I like it because it's a here and now therapy. Therapy. It's not more like, it's like, okay, let me explain a bit how we do CBT therapy. It's not like you come into a counselor's office and lie on the couch and sit and talk wildly about your feelings and about your emotions. And no, we have skills and techniques that we follow. We usually sit opposite the client in a respectful way. There's ethical codes that we carry, and mindfulness, boundaries, confidentiality, because if we breach a confidentiality, that can give us consequences of going to court. Our license could be revoked from us. So there is a certain decent mindfulness professional pattern that we are trained as mental health counselors and especially as CBT counselors to work at. We sit opposite the client in a respectful way. We explain to them the rules from the start. First, what we do is give them a questionnaire form, just like the doctor gives you a questionnaire form, and then the person crosses off like how high is your anxiety, how low is your depression, how high is your depression, what symptoms what medications are you on, what symptoms do you get of those medications, because those are all important procedures that we have to follow. Just say, God forbid, we get someone who's been sent to CBT but suffers of diabetes and is supposed to be on insulin, or somebody who has a seizure and we do not know what kind of medications they're on. So instead of the panic and such things, we're supposed to be professionals. So we are supposed to know like what our client is using, what kind of medication they're using. If they're on drugs, we check for the symptoms. If they do not even tell us, that is that one thing of the behavior. When I usually say as a cognitive behavior therapist, like the way I analyze things, in some cases it's because we do have to check. Like, so it's not like if somebody comes and says, I've never been on drugs and I'm not under drugs. We can see because we're sitting face to face and we have the skills. We know what we're searching for, what to check and what not to check for, what is important. We don't look at it as what is important for us just to sit and write in our notes, but what is important so that we can do a health, like mental health assessment, to find out that what is the reason that is getting this person so depressed, of anxiety mood or such things. And that could be drugs. I've said that many times before. Many people argue with me on live chats. I've stopped going to live chats. They say, oh, that's no excuse. They think that when I'm certain things, when I'm talking about, like, a quick thing is when I say like drug addiction, they can lead to mental illness. People misunderstand and say, yeah, don't make excuses for them and all. I'm not making excuses for anyone, but it's a known fact. It's scientifically proven. People on heavy drugs end up into serious mental illness like schizophrenia. I'm not saying all kind of schizophrenia comes from drug use, but I'm saying drug use has something linking on always with mental health illness. That's why we advise people to avoid drugs, avoid too much alcohol, avoid alcohol if they can in general, because nothing good comes out of that. So like I was saying, we sit in a counseling suite, ethically moral, with the ethical moral behavior, the way we dress even. We're not supposed to be too revealing. I've noticed it's different from country to country, I guess, but that was one thing our teacher was very persistent to tell us all the time. Make sure that you'll sit right as a mental health counselor. Because imagine, she said, if you're wearing a short dress or short mini, just say example, and you're dressed like more like you should be dressed out for a party or for a nightclub with a mini dress, and you sit there with your legs crossed and with high heels and all. She said it just shows not only your character, you're supposed to be professional and you're supposed to be at work, but she said it's always important in mental health that not to forget that you're dealing with vulnerable victims, vulnerable patients or clients. So you don't want them to get the wrong impression or make a move at you, or if you smile too much at them, they may take that as a welcoming sign, too open sign, and such things. She even told us, I remember, like if you see a client, just say after session, you go to a mall and you see a client with their girlfriend or by themselves, and you're with your family and they come and approach you. Our teacher used to say, try to avoid not, try to act like you're ignoring them. And we used to say, but that's so unprofessional, that's rude. We used to tell our teacher, she used to say, no, it's not that. Because do not welcome your client a lot by talking to them, introducing your family to them, because you're putting yourself in risk, your family at risk, you're dealing with vulnerable people. So they may not treat you the same when you come to the next session. They may in fact think they know you better. She said, never give out your home numbers, your phone number. Always keep it strictly professional. So there are such things. To start with, I grew up in different countries. I went to different kind of schools. So I used to always be an open person, but I used to always show my mindfulness. And I think that is something the way I was raised. And it has a lot to do with not only my background, with my religion too. So it made it much more easier for me in mental health to work as a mental health counselor for the 3 years. Already, I believe, like growing up in a boarding school, I already had that adapted in me. So later on, in mental health illness, that wasn't a problem for me, because when you're in a boarding school, you learn boundaries from the start. So this just helped me to be an extra better person of how I came in learning counseling. It just taught me more to be mindful, to be professional, to have boundaries, to have confidentiality, to remember to be always respectful, to remember that we're dealing with vulnerable people, not to get too close to them, because that can be breach of the policies as a mental health counselor. So those are things we work with. I see a lot of improvement with people I've worked with through CBT. They really seem to enjoy CBT, because that's the thing, many people assume as mental health counselors it's our job to heal people. We don't heal people. What we do is we challenge people's questions, find out what they're suffering of, and then try to work with them by giving them homework and CBT techniques and skills that they can use later, which helps to improve their lifestyle. And they always say that. They go back to their notes. I always advise them to keep their notes so that they can go back to their notes when they move on in their life. And it really does help. Guys, look after yourselves. Look after your loved ones. Look after each other. Be good to each other. Life is short. Drink plenty of water. Eat healthy food. And don't be like the people who are standing in front of baby Q's house up to no good, because that is not like us. We need to be better than that. By even subscribing to those people and by following them, we are no better. We are no better, and we are not putting respect on baby Q or baby Summer or baby Michael Wong or any of their names by following such unprofessional, unmindful people. Everything opposite to what I just said we learn in counseling. That is no way to behave for them. They're there to, that's what disgusts me. They're there to collect money from blood money from a child, a missing child. Stay blessed, guys. Look after yourselves. Look after yourselves. Be good to each other. It's winter. Have your vitamins. Do some training. And look after each other. Love you guys. Bye.